there is a bidirectional relationship between COVID-19 and diabetes. On the one hand, diabetes is associated with an increased risk of severe COVID-19. On the other, there is a new onset diabetes and severe metabolic complications of pre-existing diabetes. Why is this happening?
So this is a very interesting question, and this is what we've been facing, and we were discussing with Dr. Rajesh just before the start of the program, that fortunately the worst period of COVID seems to be over, and we are very glad about that. But what was very unfortunate was that the patients with diabetes had to face a tougher period during the COVID. Why? This is very important to know, because diabetes is a chronic illness. When diabetes is uncontrolled, the glucose levels are high, and the high glucose levels is what we call glucotoxicity, is toxic to the bone marrow. For working of the immune system of the body, we have different cells, the immune cells, the T cells. Some special sort of chemicals are made by the cells of the body, which fight with the pathogens, whatever viruses or bacteria, our bloodstream, either through our nose or through our food or through the vent pipe through the lungs, adversely affected by high glucose levels or uncontrolled diabetes. So what in effect means is that the immune system is not able to function as coherently, as vigorously as it functions in a normal individual, or even in an individual who is having diabetes, but the diabetes throat has been controlled. So a person with uncontrolled diabetes has a sort of malfunctioning or poorly functioning immune system. And we have understood very well in this pandemic of COVID that the immune system plays a very vital role first in prevention of COVID. Not everyone who was exposed to the COVID virus got the infection, and not all those who did have the infection fared very badly. All the patients who got COVID, people who are having diabetes, type 2 diabetes or type 1 diabetes, and whose sugar levels were uncontrolled, they fared much, much worse during the COVID. Their ICU stays, the period of time which they had to be admitted, especially to ICU. And even before that, the number of patients who got admitted to ICU of all those admitted was substantially higher in diabetics. And those who were admitted eventually to the ICU, diabetics, and especially those with uncontrolled diabetes, had longer ICU stays. Their average stay was around 20 days. So they had to stay in the ICU for a longer period of time. And their mortality, that is the death caused because of COVID, was also much more in diabetes. So overall, diabetes has actually adversely affected COVID. Now, as you said very truly, that there's a bidirectional relationship. Does COVID cause diabetes? Sometimes this question also comes up. Actually, the fact is that the COVID virus enters our body through the ACE receptor. And these receptors are present in the beta cells of pancreas, in the gastrointestinal tract. So what happens is that these viruses naturally get more attached to these cells, the pancreatic cells, the beta cells, and then the immune reaction takes place. The body, in the process of killing the viruses, kills the cells as well, which is where the virus is located. So there have been incidences, there have been published reports that people who've had COVID infection, who are not diabetic at the time of infection with COVID, after 3 to 4 months or 6 months of having recovered, they develop diabetes. Now, this is a hypothesis. It may be there, it may not be there. We cannot say for sure that everyone who had COVID later on developed diabetes. So it may be there, there are a lot of doubts about it. Maybe it was unmasking of diabetes, because diabetes is not a disease which pops up suddenly. It takes years to develop. And we notice a rise in glucose level only when 50% of the pancreatic beta cells are gone. So probably it may have been an unmasking, that is, it presented at the time because of the tremendous stress of the disease, because COVID had causes a lot of metabolic stress on the whole organism as such. So there could be a number of reasons for that. The other thing is that COVID majorly affects the lungs, and the immune reaction destroys the tissue of the lungs, and that is what led to the breathlessness and a lot of death, because people were just not able to exchange oxygen properly. Now, I would just like to expand here, and I would like to touch upon a topic which you started with. You started with a very, very interesting topic, and that is the topic of sleep and the role of sleep in diabetes. Very few people actually understand the importance of sleep and diabetes, and there's a condition called obstructive sleep apnea. People who are obese, those who are overweight, they carry a lot of fat in their tummy, and the fat is not only in the abdomen tummy, it is in the throat, under the skin. And what happens is, when they're lying down, that pad of fat literally blocks their airway. They're not able to breathe and they're not able to take in any oxygen. So that leads to the increase in the levels of carbon dioxide. They lose their sleep, and it happens in cycles. You see, sleep is not a passive process, it is an active process. There are different stages of sleep. So we must go through all of them to be refreshed. So what happens is, as a result of this disruption of the sleep cycle, these people don't get a proper sleep. They might be sleeping for 8 hours or 10 hours, but still they are not refreshed. And as a result of that, they have a lot of complications. And one of very important complications is uncontrolled diabetes. So the people who are obese, who snore a lot, who feel very sleepy during the daytime, they might be suffering from a condition called obstructive sleep apnea. They need a very specialized treatment. And a number of times, a lot of complications of diabetes, uncontrolled diabetes, can just be controlled by offering them this treatment of CPAP, or giving them relief from the obstructive sleep episodes. We did a study in Delhi, and we found that 56% of the adult population that we screened about 13,000 people all over Delhi, are obese. They have BMI of more than 25. So that is an enormous amount of people. I'm telling you all this in context of COVID only. So we have a lot of people who are having this obstructive sleep apnea, the sleep deficit. This also leads to the disruption of the immune system, the immune function, and people who already have OSA, they were more prone to suffer from complications of COVID and such diseases. So it is actually more complicated. There are a lot of things were happening at the time of COVID. Obesity also played a very important role, and people who had obstructive sleep apnea, they also suffered more consequences and complications from COVID, just as we are talking about diabetes. So I think I've touched upon this. So